everybody, welcome back to Beauty Buzz with Lori. And I have here with me Becky, our nurse practitioner.
Hello.
We're here at Garcia Facial Plastic Surgery, and today we're going to be talking about injectables. So injectables, Becky, there's lots of different injectables, right?
Correct.
Can you tell us, first of all, maybe where people might get injectables done?
Sure. So yeah, and whenever someone comes in for their first treatment or for a consultation, basically I hand them a mirror and ask them to tell me about their areas of concern. And basically, any area of concern you have, there's something we can do to help get some improvement there.
Some of the areas might be nasolabial folds, marionettes that are right here, and pull the mouth down. What other areas? Tear troughs?
Tear troughs are a big one, and that's something that affects people young and old. And it's amazing what a little bit of volume in that area can do. The cheeks are a big one too, because as we age, our volume descends. So adding just a little bit of volume there can really help give the face a more youthful shape without being dramatic.
Lips are another area. So I happen to know that Becky does a really natural job with all of her fillers. One of the things that I like about how you conduct your treatments is that you address the patient's concerns. You do a little bit of filler, and then you have them come back a couple weeks later for a follow-up, and basically at that time the swelling that they may be experiencing the first day or so has gone down, and they're able to better see their final result, even though we actually do see results. They happen immediately, right?
Exactly. That's what I tell people. The volume added happens immediately, but as you said, there's some irritation, some swelling, so I love to have people come back for a follow-up visit. We pull up their before and after on the iPad, and they can see exactly, what changes have been made, and from there we can talk about if they just want to maintain that look, or if they have some next steps, maybe other areas that they want to address. And that's the nice thing with fillers too, is we can kind of take it slow, whatever pace people are comfortable with. We can always add more.
Yeah, and so with the, let's talk about the pictures a little bit. A lot of times, even 2 weeks later, we can forget what we looked like before. When we were looking at ourselves for 2 weeks in the mirror with the filler in as well. So talk a little bit about, progression photos.
So like you said, sometimes people kind of just get used to their new look, so people are often really pleasantly surprised when they see the before and after and see the improvement that was made. That's a lot of fun to see that, and people are generally very pleased with the results of what even just a couple of syringes of filler can do.
So I know that there's a lot of different fillers that can be used. You have certain fillers you use for certain areas because of maybe their thickness or the type of volume that
Exactly, yeah. A lot of my patients will do some research on their own and have ideas of what they want where. But that's something that I certainly know a lot about and can advise which fillers are best in which areas, how long they might last, and really help people pick out the treatment plan that's best.
All right, so I'm going to go ahead and ask the question that everybody wants to know is, does it hurt?
That's a great question. So we do everything we can to provide for patient comfort. I have a topical numbing cream that can be used. We always have patients ice before treatment, which helps a lot. And then in the actual products, there's lidocaine. So people, after the first injection or two, they start to become even more numb. So we actually also have laughing gas now, which people are telling me it's very helpful. It's very quick acting, so as soon as people start taking a couple breaths of the laughing gas, they're feeling very relaxed and are able to get through their injections very easily.
Okay, kind of eases the anxiety that comes along with
Definitely,
this.
Yeah.
Okay, I can see that being beneficial.
Definitely. There's a small extra charge associated with the laughing gas, but it really helps people with needle anxiety to just kind of make what could be a really scary experience a really pleasant one.
Okay.
Yeah.
And so with laughing gas, does someone need a driver after they're done?
No, that's the great thing about it too, is about 10 or 15 minutes after their last inhalation, they're perfectly safe to drive.
Okay.
Yes, it's very quick acting, and then it really doesn't stay with you for long. So, It's been very helpful.
Nice.
Yeah.
Now, would you suggest that people refer to photos, whether it be old photos of themselves or they see someone they want lips like and stuff like that? Is that helpful for them to bring those things into you to show you, to give you an idea of what they're looking for? And also in order for you to maybe manage expectations a little bit?
Absolutely, yes. Photos definitely help because we can really make sure we're on the same page, and as far as managing expectations, I can let people know how many syringes it would take to get the look that they want.
Okay.
And really help them, understand what the fillers can and can't do.
Okay. So I know that a lot of times people will call on the phone and they want to have a quote given over the phone. So here at Garcia Facial Plastic Surgery, we really don't like to do that because you need to see them in order to give them a quote so that you can talk about how many syringes it might take in order to achieve the expectations that they have.
Exactly, yes. And our focus is always on getting the best outcomes for our patients. And that definitely an in-person consultation can help, to make sure we understand the goals and get people the results that they want.
If someone's thinking about having injectables, is there anything you would like to say to them, especially if they've never had it done before?
Oh, absolutely. So there's a risk of bruising anytime a needle enters the skin. But things like avoiding alcohol and Motrin and popular supplement biotin, those can all increase the likelihood of bruising. So avoiding those things for about 2 days before your injections. You can take arnica, which is an all-natural supplement. You can start taking that about 4 days before your injections, and that can reduce your likelihood of bruising.
And that's something that we provide, the topical and the oral version of medical grade arnica here at the office, right?
Yep, that's correct. You can get it here. And even with those precautions, it is possible to bruise. Usually if someone does bruise, it's very small and easy to cover up, and they always go away. But just something to keep in mind if you've got an important event coming up.
Okay. I know that personally I've worked with the arnica, the oral one and the topical one, but I usually will start taking the arnica about 4 or 5 days prior to when I know I'm going to be having an injectable. And I can definitely say that it has decreased the longevity of how long that bruise hangs around. So it definitely does work, and then the topical afterwards helps it to go away faster as well. So, all right. Well, I thank you for sharing your expertise with us today.
My pleasure.
And so if you're interested in having injectables done, you can give the office a call and have a consultation here with Becky, our nurse practitioner, and she will get you all set up for that.
Yep.
All right. Thank you.